If you have allergic asthma, chronic hives, or nasal polyps, your doctor may recommend the medication Omalizumab, also known as Xolair. This drug is used to treat these conditions and can help to improve your symptoms. If you're wondering how Omalizumab works, how to take it, and how much it will cost, we'll answer some common questions about this medication. Omalizumab, also known as Xolair, is a medication used to treat allergic asthma, chronic hives, and nasal polyps. It is given as a shot under the skin every 2 or 4 weeks, either as a pre-filled syringe or as a powder that is mixed with liquid and injected. After receiving the shot at the doctor's office or clinic, they may teach you how to give yourself the shots at home. Omalizumab has been available on the market since 2003 and is the first monoclonal antibody to treat severe allergic asthma, chronic hives, and nasal polyps. Omalizumab, also known as Xolair, is approved to treat the following conditions. Allergic asthma. If you have moderate to severe asthma and inhaled corticosteroids are not effective, your doctor may prescribe Omalizumab to reduce asthma attacks. It is approved for people aged 6 and older. Chronic hives. Omalizumab is also approved to treat chronic hives, also known as idiopathic urticaria. It is prescribed for people 12 and older who do not respond to antihistamines. Nasal polyps. Doctors use Omalizumab to reduce nasal polyp size and nasal congestion in people 18 and older who have not responded well to nasal corticosteroids. Nasal polyps are non-cancerous growths in the nasal passages that can block airflow and cause infections, and they are common in people with allergies or asthma. Omalizumab, also known as Xolair, is a type of biologic drug called a monoclonal antibody. This means that it is made from human, animal, or microorganism cells. Monoclonal antibodies are copies of living proteins that work like the antibodies naturally found in your body. Unlike traditional chemical drugs, which are made through chemical processes, biologics like Omalizumab come from living cells and are more complex to manufacture. When you have an allergic reaction, your body produces a substance called IgA, which attaches to the allergen and inflammatory cells, causing inflammation. Omalizumab works by stopping IgA from attaching to your inflammatory cells, reducing the levels of IgA in your body and preventing the process that leads to symptoms. In allergic asthma, Omalizumab targets IgA, which is a root cause of the condition. By binding to IgA, the medicine can reduce asthma attacks. However, it is not meant to be used during a sudden attack and is usually taken alongside an inhaler or other long-term control medications. For chronic hives, Omalizumab can lower the number of hives and ease itching by blocking IgA from attaching to inflammatory cells. In the case of nasal polyps, the medicine can prevent inflammation and reduce the size of polyps, making it easier to breathe. So, if you have allergic asthma or nasal polyps, you'll likely need to take Omalizumab every 2 or 4 weeks. However, if you're using it to treat chronic hives, you'll probably only need it every 4 weeks. Your doctor will be able to determine the right dose for you and how often you should take it. Before prescribing Omalizumab for asthma or nasal polyps, your doctor will need to take your blood. This helps them figure out your IgA levels, decide the appropriate dosage for you, and determine how often you should take it. But don't worry, they won't need to do blood work before starting this medication for hives. Some common side effects of Omalizumab, Xolair, may include swelling, redness, pain, or itching where the needle goes in. Muscle or joint aches. Fatigue. Stomach pain. Nosebleeds. Nausea. Headache. Ear pain. Swelling in your nose, sinuses, or throat. More serious side effects may include fever, rash, muscle aches, or swollen glands within a few days of injection. Coughing up blood. Shortness of breath. Sores on your skin. Numbness, tingling, or severe pain in your hands and feet. Omalizumab, Xolair, has been effective in treating the conditions it's approved for. It's generally safe and people usually see positive results when using it. Even after 10 years of use, the risk for side effects, especially anaphylaxis, does not increase. However, it's important to note that Omalizumab may not be suitable for everyone. If you are sensitive to any of its ingredients or have had a severe allergic reaction called anaphylaxis in the past, you should not take this medication. There are some warnings to consider if you are taking omalizumab. Anaphylaxis, a rare and life-threatening allergic reaction, can occur shortly after taking the drug. Symptoms include wheezing or shortness of breath, dizziness, changes in heart rate, swelling in the throat or tongue, and feeling flushed. It's important to be monitored by a doctor after taking the medication in case emergency care is needed. Some people have reported getting cancer after taking omalizumab, but current medical research does not support the idea that the drug causes cancer. Omalizumab is not meant to treat a serious asthma attack or bronchospasm, but rather as a preventive measure. If your asthma is not improving or seems to get worse after starting the medication, you should consult your doctor. While taking omalizumab, you may be able to use less corticosteroids, but it's important to check with your doctor before making any changes. It's also important to avoid suddenly stopping corticosteroids if you take them for nasal polyps or asthma. There is a rare risk of developing eosinophilia, an increase in a certain type of white blood cells, while taking omalizumab. This may not always cause symptoms, but can be diagnosed through routine blood tests. If you experience symptoms such as fever, rash, or joint pain within a few days of your injection, you should inform your doctor. Your doctor may also monitor you for signs of parasitic infections while taking omalizumab. It's important to be aware of these potential risks and consult with your doctor if you have any concerns about taking omalizumab. When it comes to weight, omalizumab, also known as Xolair, has not been officially listed as a medication that can cause weight gain as a side effect. In fact, some studies have suggested that it may even cause weight loss, but the evidence is not conclusive. There has been one reported case of omalizumab being linked to weight gain, but more research is needed to confirm this. Overall, research has shown that omalizumab is effective for people of all weights, so weight should not be a concern when considering this medication. Monoclonal antibodies like omalizumab can be more expensive than other asthma treatments. The cost of omalizumab depends on the dosage your doctor prescribes for you, and it can range from 75 mg to 600 mg. The medication comes in single-dose syringes of 75 mg and 150 mg, as well as a powder that gets mixed with a liquid. The price of omalizumab can also be influenced by your insurance coverage or your income. Without insurance, the cost of a 1-month supply can range from $541 to $2,706, depending on the dosage. Another report states that one 150 mg syringe is priced at $2,246.20. Omalizumab may not be easily available at retail pharmacies, so you may need to get it directly from your doctor or a specialty pharmacy. Medicare and Medicaid may cover omalizumab, but you may need prior authorization from your insurance company before you can receive it. If you have private insurance, you may qualify for the Xolair copay program, which can help with the cost of the medication. Additionally, there are independent copay assistance foundations that can provide financial support for those with government or private health insurance. The Genentech Patient Foundation also offers assistance for those who meet certain income criteria. Omalizumab, also known as Xolair, does not have a generic version available. This is because generic versions are only available for traditional, chemical drugs, and not for biologics like omalizumab. However, there are similar versions of biologics called biosimilars, which must also be safe and effective like the original versions. Currently, there is no biosimilar for omalizumab, but it is possible that one could be available in the near future.